Okay, so you got, there's about 40 sheets of paper, there's 40 copies I've made, so it should be enough for everybody. But I just put 5 in each table, so if nobody has one, there probably should be an extra at the table you get it, but it's, so what we're going to do is, item C from the last discussion, and item A kind of go into the same realm, so we're going to go into those. That's the home rule discussion, and then the juvenile issue discussion. And so, the sheet itself is planned so we can give you a background, some proposal here, but let me give you a background on how, I guess I put this in paper to discuss here. Quite frankly, the last 4, 5, 6, probably past 8 years, Douglas County's been just going out this home rule study idea, but the rush and other things in the legislature was obviously this wasn't going to go anywhere. We did something for a study. I don't know how much that really went in, but I saw this option when I was the National Association of Counties President, and people were doing this, and basically they would get at this to get out of the fact that in national legal terms, if you sing one county, you sing one county. And so they were trying to get at this to get through the distinctions everybody had. Now, how this discussion happened is, when the Carney Geneva issue happened, there is from my understanding, a group of senators really thinking through how do they get more accountability for information with Carney Geneva under the judiciary. Because when they want to give information out, they'll give it when they give stuff that separation policy is not being used. So this is where that discussion happened. Background-wise, I saw this discussion with Brad Ashley because he was the chair of the judiciary at the time. And when he was chair, Manny McGill was there, Lake Oklahoma Committee and not chair. That's when the pace and the heart of a lot of this juvenile reform across the state started moving. And so these ideas of stuff I kind of threw off them. I told them I bring to this group to see. I kind of have a corner discussion with Deb about this in the cook. And so what you see here is just the framework of some discussion that happened with a couple of groups of people. The reason I bring it to you, though, is, the core principle of this thing that it poses as an opt-in. I don't expect this to go anywhere this year as far as passage, but there's probably one senator that think might be interested in putting this thing out there to get to a certain point. They think some people think the opportunity may be good just to put some Carney and Geneva accountability at some local levels, and there, at least on our juvenile events, the feel is they have the same kids that Carney and Geneva for years because they don't like the results that happen, and they sincerely believe that they need to be more local. So, in some realm, that Carney and Geneva discussion is kind of a Trojan horse to talk about bringing some of this local. So, some of the discussion that happened with community executive that we had early on with some of the discussion that goes into the juvenile piece. Can you bring it local? Now, for us, there's a whole different dynamic because of the discussions that we've had for this bill and some of the projects that there's a lot of private people talking about putting money in the system. I mean, my personal explanation that I've always told people is that whatever happens with this building, the building is an easy discussion. The program is the big discussion. And so the heart of some of this is how do you get to a framework where you put money into the system locally to have some local solutions. And when we get to the legislature, not put 92 other counties in a situation with others that they are not. And so that's really the framework of this. So I throw it out there to be put in the mix with this larger juvenile discussion. So whoever has juvenile issues on there, want to add to it, build to it, go forward. And that's kind of where we're at now with that. So that's the heart of it. Questions, concerns, discussions? Mike?
I'm very much in favor of this concept. I think tomorrow from Green Leader, I think this sets us free. We have so much difficulty in this whole session today talking about how to go to the legislature and beg for some authority. And up and say that I will come back and start talking and listening to counties, see what happens. Well, he did. He got up. It didn't happen. But he spoke. When he did, the whole place erupted and stood up and applauded him. And I looked at his face and was like, shocked. And he came past and he said, "You meant it?" I said, "Yeah." But he didn't do anything about it because we still don't have the kind of relationship we need. But this sort of thing gives us authority that we need. Some years ago, I worked with Steve Erdman when he was a county commissioner. And Steve is, having to the right of me, but anyway. We had a great time, got along really well. And so we were talking about what should happen with county government. And he got his senator, I can't remember now. I went into a room there, 4 or 5 minutes, just looked at I walked into a death penalty or something. They were really serious. Very conservative people. What they wanted to do, the bill they had, was to take all of the line offices, the assessor, the treasurer, all those folks, and make them the appointed people by the county board. Okay? And that he had a little problem with some things in Noel County. So it ended up that all these people were for it. There was a big blizzard out west, so I'm the only person who shows up to testify, the only person. And of course, they were noticing who introduced the bill and all the supporters. And finally, one of the senators says, "What's the deal? Why are you here? You know, a Democrat from Omaha." And he said, "Associated with all these conservative Republicans." And I said, "Well, I guess it proves that pigs do fly." So, but I said, this is a good concept, and it would be good for government. So this sort of thing is where we need to move, where we have authority to do things like simple things, like start raising fees $5 for some report. It costs more like $12.50 or whatever it is. But we should have the authority to do that without begging the legislature to give us authority to tie all their business. So in summary, this is a terrific concept, and I hope you give it serious thought. Thanks.
And the point of, at one point in talking to Ashford and a few of these other people about it, if you go to the second page, that top point, that was the point that just kind of got the conversation that changed last couple of days. The fact is that, to really take some of the burden off. We were talking about the proposed terms used to make a larger county. There, they define a larger county as a county that's 500,000 more. And then they just said, you don't know. There may be some other small ones that we want to get there. So the core thing of this thing is that you opt in. You don't want to do it, don't do it. If you want to opt in, then go about it and make it go on that piece. So that's what the heart of it is.
Chris?
Yep.
Once somebody's opt in, they opt out 10, 15 years later?
I don't know. That's what we can talk about. But I think the concept more so is to try to change it and give some, like, for instance, the main piece is all the money the state has, you got to go deep in the system to get it. I mean, you got a small amount of money for pre-adjudicated stuff that's up front with CBA. But you have to go on probation to be able to tap the real money. Now, we had the county's legislative day in Cook, Senator Brony came, and he made a comment just about a little bit about, the fact of putting some of these kids on probation that were having some issues in schools, for truancy stuff, which is a status offense. And I went to a conference last year about this time, and Nebraska was number 2 in the amount of kids that on probation for status offense, which is pretty much a low-level crime. If you're an adult, they wouldn't touch you with, but you're using up all this time with these status offender kids when you could be doing something other place. Well, something like Senator Brony's idea gets into the legislature, you're going to have, some counties fighting that because of that philosophy. But if you get to something like this, you can go about how you want to get to it. You get to how you define detention, some other pieces of that sort, or, other matters to that point. But I think the money is going to be the hardest part, because the money brings up gloomy memories of staying in jail. And so the question would have to be, how did you get there? Is there a base formula you can go from there? They're going to have this whole discussion about revenue to some degree. I don't know if that continues over, but I think it's probably the point to put it in the ether now, because Latham had this general discussion here on October 17th when they were talking about juvenile issues in general. And of course, Pawnee and Geneva is going to be an issue. issues about solitary confinement came up, but I do think it's the right time to get there because even some of the issues that we alluded to in some of the previous discussion, is there a niche that we can carve there for a few specific issues to give more freedom there? And I bring it up more so because I think there's a really, despite whatever people may think, the whole conversation about juvenile has changed here to a whole degree. And there's a window that we got to do something big on. People can say whatever they want to, but nationally, the trend is away from putting kids in detention that don't need to be there. It proves to be worse. So the discussion is there on that. I think the legislature, by passing 11, 12, a couple of years ago, that basically says if you have not committed an adult offense, you cannot be there. The whole thing is shifting here, but all the money and control is there. To get more services to the family, you almost have to have your kids put in the system, which on the other end, they are combating by not putting the kid in the system. So the whole solution of it is to put it more locally engaged, some specific issues that can get there. And that's what the whole discussion is about.
Do you want to address the reference to public health? And how far are you're asking for home rule authority. I understand the juvenile justice, I get that. But you want home rule over every public health component?
No, I think that should be called out. But there are some matters of public health that basically, if you go into the detention center, if you go into the jail, it's not only a jail, it's a health center. I mean, basically everything you talk about there is behavioral health. All the kids that aren't dealing with the behavior, right now, for the population today, I can gauge on what's happening. There's probably 20 to 18 kids there that need a mental health capacity the state has not done. So even discussion we had locally, you hear discussion about the building, but there's a private funding right now that's taking the lead to develop an 18 to 20 bed facility to handle mental health issues locally here, which we say we're not built for in jail, and we're definitely not built for at the juvenile level. So you really can't talk criminal justice without talking public health.
So can I interrupt just for a second?
Yeah.
There might be confusion because when we talk about public health, when I think of public health, I think of the health department, and I think about infectious diseases and STDs.
Environmental.
And the county actually has some ordinance making authority in the public health sector already, which is unusual to see. So I think there's terminology here. I think
No, I'm clear in what I'm saying, and I hear you. But I'm just saying some aspects, because somebody brought this up, so I'll bring it. Like I said, this is real there if you get home, because there's some stuff locally that the Board of Health would like to do. But, for instance, the trip, the people on this trip was people from Sherwood Foundation, one of our presiding juvenile court judges, Don Klein, Chief of Probation Mary Bison, Chief of Police Todd Smatter, some people from the Public Defender's Office went on a trip to St. Paul, Minneapolis. It was 2 trips. One happened earlier to look at that one-stop facility. This one talked specifically about the program. Ramsey County has control, and this hasn't got that. Ramsey County has control of probation at the county level, social services at the county level, public health, and all the juvenile stuff. And most of some of the stuff we're dealing with statute-wise is simple. How they address the public health piece is public health does a lot of their community work to take the drama of police, the courts coming into the families. Most of the issues that we sit with around that table when they talk are families that need the service, but they will not voluntarily take it. You can't give it to them unless they voluntarily go there. Some of these places, they come at a better angle because of it's from a public health realm. They talk a little bit, and some of the edge is taken off that piece. So it's just in there for discussion. I'm not talking about ripping everything out, but it is a discussion that at other places, you're not talking juvenile unless you're talking public health. Here, with Project Harmony, the discussion in public health started where, we had a group of the Sarpy County, the learning community, Sarpy, and the Douglas County school superintendents all in one room. And this is a meeting that Don Klein had to some degree. I think Paula Kaufman had been invited and didn't come. They weren't talking about school they're talking about mental health. And so, when that happened, the Board of Health, for years, have been talking about, how do you talk about behavioral health? It's an issue, you can really feel it now. It's coming under this term of trauma-informed care. Everywhere you go, they're talking about the trauma and everything that that's infused. That's a public health issue that's in discussion in the jail, right, in the detention center right now. So that's what I mean with regards to public health. Those worlds are together, and they're not going to come apart. If you talk about any school in the area, right across the street is a federally qualified health center. All of them are in schools in OPS right now. It was like an act of God to get them in there. Now they need the capacity to work. And some of them, they get immunizations, things of that sort. There's capability that can be expanded in regards to mental health, things that they can work on with the schools, that the schools just need to get there. And they are, the school system here is trying to get this program called Strive for 95, which basically says they're trying to get a 95 attendance at each school, not just overall in the system, because it was masked in certain schools that might have a 60% rate, and some have 99. It was merging. Half the issues that they deal with to some degree up front are family health issues that if they could identify to some degree of earlier. But now, to get there, you either got to get put into the court system on probation, which I didn't know that term until recently somebody told me how they were using it and what they classified as voluntary enrollment probation, where you have kids there, and then, or you have to, there's this growing piece that they've been trying to work with here with missing kids, where the kid needs services. The state doesn't want to, and here's sponsorship. You don't want to take the kid from the family, but you cannot access the services unless they are in. So that's like this growing piece that's around it. So that's the concept of it.
I really appreciate you going through that, Chris. It's very helpful. One thing that pops in my mind is that for this concept to be successful, I think counties have to have a dedicated funding source. I'm jealous of the city. They have sales tax, and Jim Suttle got that with the city council. Got a sales tax through, as you know, on restaurants. And it now is, when you go out to eat in Omaha, it's just under 10% tax on your bill. 7 goes to the state, they send back 2 to the city, and then the city has another 2.5 tacked on that. So you're getting, this mayor was going into office, she asked to speak to somebody said, send all the old mayors, and they were surprised that I showed up. But anyway, so I talked to her about it, and I said, the first thing you need to do is go to the people who sued the city and say, like Mike Fahey did when he took over and said, the city is in such terrible shape, I can't make the reductions I said I was going to make. That's what she should have done, and she's still getting beat up because she didn't do it. But the money is approaching $40 million for the city, $40 million. And we can't get the sales tax on restaurants, but what I propose, and maybe I'll get run out of here on this one, but I think, I think what we need to do is to support sports betting. We need sports book. And, everybody, we're surrounded by gambling, and I know it's a terrible, terrible sin being raised on bingo, but anyway, we're all sinning here, because there's bingo in this town. And all around us, it's sports betting, sports book, and gambling. Down the road a piece, not too far from here, is Carter Lane, we've got a casino, and I haven't been there yet, but I hope we're going to lose some money. But anyway, the deal is, we need to be real about this. I don't know, if we don't get a dedicated financial source, we're going to be the same mess we are now. We're always begging for money from people that turn off the spigot. Like Hyman did. It just doesn't work. We got to have a dedicated funding source.
I have been in the past, very much against that. But with the internet, and the betting that takes place on the internet, I've come around to support my school. Now, I hate to say that, this is the first time I've ever said it. Because this is the first time I came around. But, the internet has, you can bet anything on the internet and stake this money.
I want to support Mike totally. I hope it's like
don't think we're going to do it like that here, most times. So we think that maybe what we gotta do is do a congressional district. You can, let's have a sports event, sorts of, in Douglas and Starkey County, where the partners are, up in Brecken. We'll have a, we'll switch over to Starkey County, do it like that. Let's vote on it, let the rest of the state do what they wanna do. If they don't wanna have gambling, that's fine, we're right next door, we're just right. You can see, I can see the casino in my home. So I think we gotta do it, vote on it by congressional district, to tell you the truth. We gotta figure a way to do that, okay?
Well, yeah, well,
We gotta have money.
yeah, no. Well, look, this is the deal. I just want to put this in the ether because it's hard. If you haven't seen it function in some other places, it's hard to grasp. I've seen it function in all the places, and it's not impressive for the states to do it. The question is just, where do you want to go? And I know Illinois did that for the same purpose. Is that Cook was so different that they had to give them room to operate. So my only piece for this is, if you see this, you got some history. You got some history of the conversation. It's not a, I don't think it's a power grab, but it is a point that some places are going to get a different level. I mean, the best example in closing, and then if there's any more issues we can go to, if not, we can move is, a couple years ago we were at Metropolitan Community College, probably 3 years ago last time we were here. That, I think we were there in 16 or 15. I sat on Metropolitan Community College's board in 19 when that was getting talked about. There was not enough revenue in the system of how Metro was funded to get there. Now, the way most stuff is done here on that scale is a public-private partnership. They came to the table, and private money came and helped put that with public money, and now it's changed the landscape of that corner. Probably technical training is going to give a lot of options here later. We're on the cusp of that here, where you have private money interested in changing the landscape. And if we were trying to do this on the county dime, we would never have gotten here. So, it gives you some leeway to go. And so you got the framework, you got the history discussion. So if for some reason we get somebody that's interested in it, you got a concept where you can feel comfortable and not be squeamish or scared when you know the basics. So it's all we're going to do in that respect.
Chris?
Yep.
The third bullet point, we have something that I've been more over. 1148.
1148 is I think it's a clause or a point in one of the laws where Project Harmony here, they have a team that's made up of child welfare, the police, the county attorney, social workers, and all relevant kids that are involved when there's a child neglect cause. A way to get around this too is the discussion we just had on the data piece and this piece about secrecy and sealed records and things of that sort. They get together under this clause and they're able to talk about that kid's case. All that information is there. It's protected in some form of silence. I don't know the exact deal, but that's how I subscribe to being able to talk about it. The part and vision for this is there's so many jurisdictional lines that for us to really make this effective, there needs to be that line of discussion between the school district, a health provider, the probation and other detention and correctional staff to really get the whole look at this kid. Because when you look at the kid, the question now is not so much the question that they're asking in respect to the kid, why did you do, yelling at this kid on some offenses, not all, about, why did you do this kid? The question is now, what happened to you? What is the family atmosphere that got you to this point? And when you peel back and look at some of this data on some of the kids, for years you would treat the kid and you forget all about the family. You do something for the kid in the facility, but you don't put the service in the home so when the kid gets back, it's all back messed up and nobody serving the family. So this kind of gives you a cone of silence to look at this and everybody that's involved be able to put a plan together to get there. Some of that line is there, some of that line is not there, right? And one of the things that's really not being discussed, but it was brought up at that hearing is, parents have this opt-out option here on some things. I don't know all of the law to it, states you go to, you know, some of the payments are mandated to get there at some point. Here it has to be voluntary, and I think that's why especially in other places, has rose up here at some point, probably. So, you got it, you got any questions, call, go from there. Any other juvenile issues you want to discuss?
Were you gonna talk about probation?
You can go ahead, it's an option, you can always include it in.
So, this is just something to think about. I'm not saying that I really get in my mind about it, but in a lot of places around the country where juvenile justice reform has really been successful, probation is a county function. And it creates greater communication, collaboration with it being under the county board. Here, it's a state function and it's under the Supreme Court. That thought was always a little bit odd, that the Supreme Court would control probation. So I'm more concerned about juvenile probation than about adult probation. I think theoretically, juvenile probation with a county agency, juvenile justice reform would work a lot better. We'd make a lot more progress. Rather than having to go to the state when we have issues with how probation is collaborating, what are some of the issues we've had with juvenile probation. Although, you know, Mary Bicek does a great job of what she has to work with. A lot of times she doesn't get very minimal resources from the state. Of course, the downside could be, you know, the funding. You know, if we could convince the state to give us the funding for probation that they have now, but then a few years down the road, that funding dry up and it would just become strictly on the county taxpayers' back. So that's something to think about. But it's just something to plant the seed. Maybe think about it in a long session next year. I think it would work in the long run.
You
I'm struggling to see the connection between home rule and the juvenile issues. I would comment that in 2013, the City of Lincoln and Lancaster did a study on consolidation. The final recommendation was a consolidated municipal county, which is allowed in statute already with a home rule charter authority. And in looking at that, just saying your home rule doesn't mean you have carte blanche to do whatever you want. You still have limitations in state statute. So what I'm thinking maybe, and so you could do it right now, you could do a municipal county in Omaha and Douglas, and you'd have all of the authority that the city of Omaha has now, including funding sources that could be spread throughout the entire county. But it really comes down to a partnership at the state, county, and city level, especially in the counties that are more municipal, and pooling all the resources, and whether it's a joint public agency or a municipal county or whatever, it takes all three partners. And you could possibly expand some funding sources becoming a municipal county, to get the sales tax throughout, and real tax out of the grid. But really, that's the approach. I mean, just county going off by itself and saying, I'm a home rule county now, doesn't get you there for the funding unless the state comes along, because it really comes down, and the private sector as well. So I think maybe the mechanisms are there already for joint county, city, state cooperation. It just needs to be done. So.
No, I mean, if you look at the second page, I'm agreeing with what you're saying. I mean, you could do that. You could do that merger piece, but you still are going to get access to some of the funds for the child welfare pieces of service that you get there. Then, I mean, on that, on the, fifth bullet point on the second page, I acknowledge that. I mean, the point of it, it's all about the flexibility of pay to be used, and it's all about some control to some degree. That state still don't have overarching part, but the point is you have to get to the state piece to draw that. I mean, the couple of juvenile judges gave me the number, and I don't have this verified. They said somewhere between $500,000 and $700,000 per kid is being used if they're county juvenile. And now, I don't know what the population is. I know there's some kids there from certain pieces that could be used locally for as a better piece, but you got to get in the system to tap that. So what you're saying, I'm definitely on it. And part of the piece of this is you have to figure out what the funding is. It's very sketchy. The point of it is discussed to some degree. But you know, another discussion is, so at the time, I had it was so crazy that I didn't want them to come out there and get abused in front of the board on the floor. I had some people from Promise Ship come to me and ask the county to put some money in for them for services. I was like, what? I'm like, you get state money. You asking the county to come give you money for services? I said, you serious? You want me to put you out there on the floor and really just get hazed by certain members that will take them to places they don't know? And I was like, what, the state money's not enough? And they start talking all of this stuff about Medicaid, being turned down by the 3 providers, and other stuff like that. You know, it's not working exactly like it is in the system, a lot of those kids locally, but the point is that it's been done in some other places. They have some resources to look at and get in, so it's not like they're creating a wig, recreating a wig. But I think the discussion is going to have to happen to some degree, because right now, nobody has it. From when I first engaged with this in 2004, when I used to work for the mayor of Omaha, and I went to a dedication when Douglas County opened the Juvenile Assessment Center in 2004, the pace and the issues have changed a whole lot. I don't think anybody in the state's dealing with it to that degree, and there's some other states that have found a solution to that by this. So your point about the money is in there, I wholeheartedly agree, and there will still be some limitations if you merge city county. And I'm not a lawyer, I don't know it, but that's my gut to sit at the table and working through this thing intently with them on it.
The point I would make too is, we've talked about this for years, juvenile justice reform and the funding.
Yeah.
There are statutes in place that says if there are not sufficient monies in place so the state can perform their functions with regard to juveniles, the county court has the ability to assess that to the county. The county shall appropriate a fund which will be used for basically state services if the state decides not to fund it adequately. So we need to get rid of that, and then that's really where the partnership comes in.
I agree with you.
Those statutes are out there. So that's
Well,
what we're
and-
about juvenile justice reform.
The only other point I'll go for that is that, you know, I've been around that table with a couple of families, you know, you got the state and the county there making this moral argument. No, my kid's in need, but no, you pay for it. No, you pay for it. And then the family and the kids, they're hurting. I'm like, you know, I don't want to be in that moral argument. The fact is that kids hurting, families hurting. You know, how do you solve this issue?
Gary, under what you're talking about, I forgot about that, but who ends up being the governing body? Is the county merged with the city or vice versa or something?
Well, it would become an entirely separate entity. It's in the Municipal County Act. I've got a copy of the statute here in this other folder. It would be a situation where the devil's in the detail. If on merging, you would need to get together and elect a council. You'd have to decide the form of government, whether it's strong mayor or whatever. But all the existing city ordinances and all the existing county resolutions or whatever limited authority you have in the ordinance would all be effective at once. There's going to be conflicts, and then as the new municipal county council passes legislation, that would be governing in that area. But it would be based on whatever enabling authority there is for a home rule city like the Lincoln, and whatever enabling authority there is for a county. So it doesn't create any new authority out there, but it gives you a lot of flexibility
400 beds. It really does, that the old build it and they will come applies every single time. And I've used this term, that is a paralyzing fear I've had for 2 years. Let's build smaller. But we can't. We're going from 180,000 to 350,000 people in the next 25 years to come in. And so 400 beds, but really for the awareness here, this 148 bed facility, we've not really made decisions on what to do with that. It needs millions of dollars to come in compliance, right, Stu?
One plus.
Yeah, to come into compliance, but it is a jail. We've had lots of discussions, and the health comes into the fold, and so just as a collective 3-county area, we've got this. I mean, my sense tells me in the discussions that I guess the conventional wisdom is we'll move those inmates in over on that day, and we're talking about somewhere between 3 to 5 years from this moment to open it up. You're going to have to design 2 to 3 years to construct, and use that for some type of expansion in Sarpy County, but in the meantime, a lot happens in 5 years in the 3 biggest counties in corrections. And so we've got this structure that's built as a jail that we don't have a plan for. So, Chairman or Vice Chair, like to add anything to that discussion?
Thrown out the door for a point of information, but also if there's ways that Douglas would like to begin some discussion or the 3 counties together to look at how can that facility be repurposed and for what cause it could be used for, or Douglas wants to pay for a new jail.
What do a building commission think?
We've had that, I have a note of that written down, but maybe instead of looking at the building commission, we should extend and allow Sarpy to do that. That'll lead to some negotiations. Final comment, maybe a segue into the last discussion item here for the working lunch and mental health. Over the last 2 or 3 years, 2 Sarpy counties made a really concerted effort, at least trying to figure out how to do mental health better. Terry mentioned it through here or where we go. One is mental health facility sitting there in our overcrowded 150-plus bed jail, sitting there with very limited services. And quite frankly, it's just not the right thing to do. Forget the jail population and the cost. You know, we owe people better. We believe in government. Our leadership team, the chairman, the vice chair, and the committee switching up. Some Andy's been really involved here recently. Is our new jail. And for those of you that don't know, Stu Del Castro, that was introduced earlier, he was part of the Potawatomi County Jail from what year?
A long time ago.
Yeah, part of you were there when we were building that, and there's a lot of institutional district corrections expertise and Stu from the west side of our team. But our new jail will have a really focused effort on how do we treat those that are mentally ill and still have to be in jail. That happens. That happens. But we don't, the data's not there, we're not very good at it. We're saying we're not very good at it. We're going to get better at it. Then you have, those Stu and I both former law enforcement officers, this crisis center that you've read some about in the paper with Sarpy County engaging with UNMC. They never did cut ties with us, but there was some level of confusion, some communication issues. We met with them last week. And they are committed. They are going to build something up here at their campus site. We're fully supportive of that. But we're going to have to be able to use that as Sarpy. There's 300 plus or minus law enforcement officers driving the streets of Sarpy County right now and dealing with mental health issues and need some PAS or psychiatric emergency department to triage those mentally ill people. But what we're missing on the backside of that is any kind of follow-up. Sheriff Jeff Davis has sent for the last 2 years a full-time committed mental health sergeant. Almost all of our police officers are trained in the ARCIT. The goal would be to get ready to
you have a detox center?
No, no, we do not. And we've taken, just in the last 2 years, Mr. Kraft, a group, again, we call it people, we not particular body went down, and some of his other attorneys to San Antonio, looking at the national model, where they certainly had a detox center. I was on that trip. 2 commissioners, Warren and Kelly, have been on one of those trips to Pima County, Arizona, where a team went down. But our mental health leadership team, and these are people, these are county board members and administration and people that are decision makers and starters. I don't think we missed a month in 2 years to try and get this better. We're not batting 1,000, but we're really passionate about this issue and trying to resolve that. Back in our policing days, it always struck me that the only people that really honor the jurisdictional lines of bureaucrat, mental health doesn't, criminals certainly don't. We should pay less attention to these lines and more attention to this collective and how we're doing it. So hence the reason we're saying, hey, we got a 138-bed building that was a jail. Is there anything collaborative we can do? Absolutely unequivocally need to coordinate and collaborate on the mental health issues.
No discussion, anybody? Go once. If there's nothing, we are done. And much is here. So you got an hour and 15 minutes back in the day. Appreciate it. Thank you. We'll talk about mental health, but nobody talking about. Am I wrong in interpreting that there's no mental health issues that we're talking about? They ain't trying to tee it up, but we can come back to lunch in 3 years when we try, but you can go ahead. So if there's mental health issues to talk about, we can talk about those.
said to the county board a few years ago, I said that my wife and I, were watching TV, and we see those commercials for the hospitals, and it just makes you want to check in. The amount of money that's being spent at a hospital on advertising is unbelievable. And my feeling is, we should be getting a portion of that money, some payment in lieu of taxes or something, that should go to mental health in our community. And I stand to be corrected. If Mary Ann was here, she has tremendous knowledge on this, but if I fall down and I've got a broken arm or something, go to emergency room and they take care of it. If you go there and you've got a mental health problem, there's probably not a lot they can do for you. And I think that we need to start to seriously deal with that, and somehow the counties coming together and starting to talk to the hospitals, I think would be a real positive. And I'm not as smart as one of always in this room, maybe not the brightest, I might take credit for it. But I think we ought to start to develop a committee to start to talk to the hospitals about this. There's been billions in advertisements. Children's Hospital, I don't care which one, and I'm not trying to fault them, but it's every single night that you watch that. And if you have a child, you're taken to the hospital, I'm not sure you're debating too much about it. You're probably thinking your child, Kevin Hall, one of our great people who works in our office, is to really meet kids. I mean, I would think if something happened, one of them had whatever, either, you're going to Children's Hospital. You're not going to debate, well, I wonder if I should go to Burger Methodist. No, I'm going to Children's, 3-year-old or whatever. So the millions that are spent, I think we ought to figure out a way that should go to mental health. And I just feel strongly about that. But I hope that some of us might come together and develop a small committee for the 3 counties and work towards seeing if we get the hospitals to have some payment in lieu of taxes, because they are totally tax exempt, and they have to spend the money. You look at 84th and Dodge, and every of the tremendous facilities are building, and they have to keep investing money, because if they have too much in reserve, they lose their nonprofit. And I talked to doctors on that told me that. So if you have some questions about what I said, I'll be glad to
Is that
try
why,
and answer them.
is that why they're always maintaining their parking garages so who will touch it?
Well, they're building more. I mean, they own the land at 87th and Dodge, and they continue to buy other doctors. Remember, this is in 10 years, and I'm sure there'll be many doctors in private practice. It's a great exit strategy. They have to do it. But anyway, I think it's something we need to look at. When we see the continuous acquisitions of properties all over, and some of them just statement like they hold for the future where Coco's was at 87th and now. So I'd like to see us develop a committee.
We should really do that and plan on seeing if we come up with something that makes sense that maybe introduce it in the next session or something, I don't know, or do some act on it.
Well,
I think we really should. I brought it up at a meeting one time and immediately was contacted by the lobbyist for Stevie Child. I wasn't prepared for it. He was teaching, so he said, well, we'll talk to you later. I remember what he did. But they're aware of the cities. I took after them because they spent $25 million making the arena downtown.
That's my billions you spend on advertising. I can understand why boards maybe pick up a truck or whatever they're advertising, you might want to buy a truck. I don't want to go to the hospital. That's the last place I want to go. So I don't care how good the ads are, if you half price off, great. I still don't want to go. Even if it's free, I don't want to be there. So it's kind of like, why are they spending so much money? They own the doctors, so if I'm doing a knee, they're going to decide where I'm going. And if I ask, Dr. Cornett that did my spinal surgery about a few months ago, where can I go? I want to go there. No, here's where I do my work, and that's where you're going. And you don't find another
here pops up, the hospital is being full assault out there on it. So, I'm just saying, that discussion is going to be in the ether. I don't know where it goes, but that's what it is.
Well, they are nonprofit, so is my company, you don't pay your rent. Basically, we'll take you to court and try to get a judgment, but we still don't get the money, well, that's a contribution, because we didn't ever collect on it, because you pay your rent. In the hospital, you go in there about 8:30 at night for kidney stone, get out about 1 p.m., you don't go in the operating room, you pass. You're gonna have a bill of about 16 to 19,000 for that one night stay in the hospital. And if you can't pay that bill, they are gonna go after you, just because you didn't have insurance or you can't afford. They're still gonna go after you to collect the money.
I used to do evictions for the Sisters of Mercy.
I know, and I always thought it was more cynical in our discussion with, my discussion with the board. We should get millions off the tax rolls. Make them pay taxes, they're not gonna do anything. They're not gonna help us with mental health order. And Chairman Kelly has said, more than one thing I've had in one conversation with MC. You're a state facility, you're a state operation, University of Nebraska Medical Center. You should be serving us here. And they did that, right? They did that. They're at least at the table. The CHI was, we can't make money.
They're so far ahead, it's unbelievable.
But keep in mind,
And then,
that they have a strong lobbying group, and it's just like this county board voted against the Woodland tax exemption, because we got an opinion. They went to the legislature, got the statute changed in the last 4 years, whatever, and Woodland was a charitable organization. That's all they do in that building now, that was charitable.
I went over to the rent property from them, we wouldn't pay taxes, I do pay taxes, it's not going to be county.
well, there seems to be a causal connection, more than a causal connection between a hospital and that. Well, that's not an unjust